An entire world is ready
for you to start your career teaching the path to wellness.
Mastering the science of mindfulness.
And the art of coaching.
To help clients achieve mental, emotional, and physical betterment of life.
Through movement,
nutrition,
recovery, and regeneration.
Because impacting one person impacts a family.
Impacting a family impacts a community.
And impacting a community impacts the world.
Become an NASM certified wellness coach.
Hello, everyone. Welcome to another episode of Random Fit. I am Wendy Batts here with my regional master instructor, my friend. Basically, I spend more time with you than anyone, Mr. Ken Miller. Ken, how are you?
I'll take it. Yes, and I'll take title of friend over associate any day.
Colleague, all that fun stuff.
Yeah, all of that. Yeah.
Give you a list of the things, all your things that follow your name when we're attached anyway. So co-host, how about that?
Yeah. Well, today, talking about list of things that we do as personal trainers, Wendy, I think you're as excited about this topic as I am because, one of the things you and I talk about is the fact that, there is a lane that we as personal trainers need to stay in, right? And from that standpoint, we know a lot about what we do, but, about the other things, that's when we want to defer, our clients to seek other help when it comes to other situations that they might be in. So when it comes to this episode of, making sure that we direct our clients and understanding health, fitness, and wellness credentials, the right person for the right job, right? That's why I think this is a pretty important episode for us to talk about and make sure that, every one of our listeners knows, what the steps are when it comes to getting the right help.
Yeah. And actually I had a client, and this is kind of, I think, another reason that we decided to do this as well, is I had a client that came and she was talking about having all of this pain. And she's like, I need you to help me with pain. And the thing is, within my scope of practice, I really don't help with pain per se. I help more with discomfort. But when you have pain, I have to stay within my scope of work. So I needed to refer out. And she's like, I don't understand. I see all these letters. I don't know what these people do. I don't know, where am I supposed to go? Is it a chiropractor? Is it a doctor? Is it you? And then, you've got all these letters. And I'm like, well, yeah, because we all have studied different things. And so with that being said, let's first talk about MD. So most people know that when you don't feel well and you've got an illness and you need someone to diagnose conditions and everything, you go and see your primary doctor. And, these individuals go through med school, and, you can become a general practitioner, which means you see everyone, you can specialize in different things. But, basically you're looking at somebody that can give you the x-rays that are needed, that can give you the prescription drugs if needed, that can set you up for surgery if that's what's needed. And so this is usually the first step that most individuals need to go to when there's pain or you're not feeling well. And that's the easiest one, I think, right?
Right. And go to your general practitioner. Yeah. Whoever it is. And hopefully, as it comes to especially going through the aging process, you've been able to see your primary care physician for years. So this is somebody who knows you. They know, what your body's been through. They've been through it with you, maybe to help you with other things. So, they have history of you and how you work and might have some idea of what it might take to get you to feel better. So once once somebody comes to you, and again, it goes both ways, right? So if I have a client who's talking about, my shoulder's been bothering me, and I actually have a buddy of mine who's had a situation with his shoulder, it comes back with the initial diagnosis of frozen shoulder, right? Mm-hmm. So, then he goes and sees, and we'll talk about other professionals within the field, but, he's seen his doctor for the last 5 years. And, because he's a triathlete, he's been physically, compromised with other sports related injuries. So with his frozen shoulder, his doctor knows what he's been through. He knows what allergies he's had. He knows how he responds to movement. And one of the first things he says, the doctor said, hey, do what you did last time. get some strengthening program, a part of your daily routine, because you can only run, swim, and bike for so much before your body starts to break down. But then when you got this shoulder situation, he's like, you're going to need to see this guy again, which is me, on how to get, which is me. Whoever you saw last time, go to that guy again. And then I'd say the same thing. He says, my foot's been bothering me. What do you think? I'm like, I'm no podiatrist. I'm no Why don't you go see your doctor about your foot first, and then they can kind of point you in the right direction from there. So the referrals go both ways. But as we're talking about with, the medical doctor, this is somebody who's probably a general practitioner a lot of times, and they can kind of defer to whatever specialist needs to be brought into the mix.
And I think it's important to say that. I mean, there are different specialists within that field too, because as you said, if somebody's going to go and see their general practitioner and it's a foot issue, they may send them off to a podiatrist. If someone's having some pain in their stomach and they've done some different tests, it may be an internist, someone that specializes in different body parts, if you will. And I mean, and when you think about an MD, that kind of leads us into a lot of these other credentials that we're going to talk about, because, the same client that came to me and was talking about all these different letters behind people's name, she's like, well, what separates you from this next one? And the next one was actually a chiropractor. And those of you guys that are just joining Ken Miller and I on Random Fit today, we're talking about understanding health and fitness and wellness credentials. So, all the letters that you see behind people's names, what does it mean? So most people understand when you see MD, they know that is basically they've gone through med school. Now, granted, there's a lot of people that say they're a doctor of something, but just remember, when we say doctor of something, it doesn't mean that they're necessarily an MD, because they could have gotten a PhD that focused on research, or an EED, which is education. And so just because it says doctor doesn't mean they're an MD as well. So, make sure that when you're looking at people and you're looking at their credentials, that they went through med school and it's actually a medical doctor. So I just wanted to say that. But when you also look into the next one we're going to talk about, and you think about chiropractic work, when you're thinking about that, that's going to be someone that's really doing more integrative medicine, and they're based on a diagnosis, and they're looking at manipulative treatment of misalignments of the different joints. So basically, they're going to look at your spine. They're probably going to do some sort of x-ray. And then from there, they're going to say, oh, your different vertebrae may be out here, or you're losing the curve of your cervical spine. Not like I'm talking from experience, right? But it allows them to look at an x-ray, and then at that point, do different manipulations to your spine to realign your joints for better movement of the spine specifically.
Right. And I think a lot of people don't realize too that chiropractors is more than just a snap, crackle, pop, right? And it's like, hey, can you just, and I'm sure people have asked you when it's like, hey, can you just can you crack my back? I haven't had my back cracked in a while. It's like, well, listen, it's, first of all, there's got to be a reason for it. And second of all, and probably more important, is like, I'm not qualified to do that. Right. Mm-hmm. So, the thing about chiropractors too, is that, I've got a couple of cousins who are chiropractors, and they're in practice up here in the Bay Area. And, the thing about, they have different specializations as well. So we talked about doctors having different specialization. Chiropractors have different approaches to how they look at the body. And again, as a form of integrated medicine, sometimes it might mean, the adjustments that we know and associate with the field of chiropractic. But sometimes it's a different approach, right? Sometimes it's more mild. Sometimes it may not be that big pop that you associate. Oh man, thanks for taking that out of there, because it's been, I've been wanting to pop it, but I've been a little stuck lately. But sometimes it's different. They look at the whole body. They just have a different approach than what we would consider, the medical doctor. So I have a few chiropractors with different specializations that I refer to as well.
Well, and one of the guys, when I went through and went back to school actually to get my manual therapy license, which I know we'll talk about later, he is a doctor of chiropractic work, but he emphasizes and studies a lot of neurology. And so he works with, patients that have had trauma to the brain that may have, something that they were born with, maybe some sort of MS. And the way that he does his practice is absolutely like, it's amazing to watch him work. I've gone watching him work with his patients multiple times because I find it absolutely fascinating. It is something that I am not credentialed to do, but again, it's always good to know what other doctors do. And one thing that I know has changed from when chiropractors first kind of started their work is it was mainly, people think of it as just like you said, an adjustment or a snap, crackle, pop. But I think too, based on all the research and evidence and everything, they're actually starting to see it's important that if you go to a chiropractor that you start thinking about what caused some of those misalignments of the joints. And there's always going to be muscles that are overactive and muscles that are underactive. Sometimes that will pull some of those vertebrae specifically out of positioning. And so once they realign them, it's important to do some sort of activation exercises to make sure that when you walk out the door 10 minutes later, it doesn't go back to where it was before you even saw the individual. So just make sure, that you do your research. But if you see a chiropractor, I think that you're going to feel a lot of relief, especially if you feel, quote, locked up. And I know myself as a manual therapist, which means more I work with muscles, if there is a joint restriction and I know I can't do some kind of mobility or a MOB to get better movement just through releasing exercise or releasing muscles, then I would send them off to a chiropractor if I saw fit. So that would be the differences between,
Right.
an MD versus a chiropractor. And then we can obviously talk about the muscle guys next.
Yeah. All right. So the next one that I work with probably more often than not is physical therapists, and that's a really big one because when it comes to especially working with athletes, Wendy, like I know you work with quite a few athletes, professional athletes, as well as collegiate athletes, but because you're operating at such a high level as a professional, as a collegiate athlete, things happen. Right. And to where you're injured, you're out of the game. But a lot of times you do need a higher level of assistance when it comes to reestablishing strength or getting through the rehabilitative process, especially in cases of, acute knee injuries, ankle sprains, shoulder issues, like I mentioned with my buddy with his frozen shoulder diagnosis. Right. And that's where you need the help of a physical therapist to not just complement what the diagnosis is through manual treatment, but again, they have a license to work with joints and work with, reestablishing range of motion through not just exercise, but using their hands to the level that they're licensed to do it. So one of the big things about my work history is that I had the opportunity to work in a physical therapy clinic where I had the awesome learning opportunity to work alongside 7 physical therapists to where as they were working on them to reestablish, movement, and as they kind of progressed away from their need of the physical therapist, they would then be kind of lateraled over to me to help them now get them ready for their activity. So whether that's just walking up the stairs or being able to play wide receiver for their high school team, that's where, again, when it comes to working alongside, especially this field of professionals, you want to know, what kind of treatment that they've been through, what their end goal is, and then as a fitness professional or performance professional, then you can kind of come up with a plan that gets them back to where they want to be.
Yeah. And I think it's important because the same thing, I mean, I know my background when I first went for my undergrad, I thought that's what I was going to do was be a physical therapist. And so I did a lot of rehabilitative science in my background and my education. But it's also important to think too, when you're coming out of surgery, one of the first places they'll tell you to go afterwards is to see a physical therapist. Insurance is usually taken by a majority of insurance, or physical therapists and specific companies. So you definitely want to check that out. But I think it's important to think about this as well. When you go to see a physical therapist, if you've had some issues with your shoulder, they will spend a lot of time working on their shoulder because that's what you came in for. And that's what they're going to be able to write off and do. And you're going to get insurance for it. However, there are some physical therapists that look at everything as a whole. So I'm not saying this is a one size fit all. And this is what I'm saying about physical therapists because I'm not. But just know that if you go in for your shoulder, they really will treat a lot of the shoulder, whether they're doing some sort of, hands-on work, some sort of needling, some sort of massagey type things, ultrasounds. I mean, they can do a lot of different things, but just know that they may not look at it at the body as a whole, which I think too, that's what kind of can blend into what Ken and I do. That's a little bit different. And the reason being is because insurance pays for them to work on the shoulder. They usually have 15 or 20 minutes per patient. It just kind of depends on how they're running their business. So if you're going to see a physical therapist and you've got, a specific thing in mind, you're going to be able to get scripts. And the scripts are, you can go see this PT for 8 different sessions. And hopefully in those 8 sessions, you feel better and all is well. If you don't, then if you don't, and you still have some reoccurring issues, then it would be good to come and see someone like Ken and I. And that's what makes it a little bit different. Again, everyone kind of has their scope and their place, but what is it that we're looking at? So when we're looking at this particular podcast on Random Fit with Ken Miller and I, when we're talking about understanding health, fitness, and wellness credentials, you have your MD, then you have your chiropractic that's going to look at, the joint specifically. You have your physical therapists that are going to look at movement patterns and different muscles. And specifically when you're coming out of surgery or you're trying to get better range of motion in particular joints, they're going to spend a lot of time doing some manual therapy in order to get better range of motion. And then that kind of leads us into what Ken and I do, which is a little bit different because we do manual therapy. That's kind of from I shouldn't say kind of, it is a blend from a licensed massage therapist into something that's more neuromuscular therapy that's very pinpoint specific after doing a full assessment to find out where range of motion is not ideal. So do you want to tell them what we do, Ken?
Well, I mean, I guess as it's commonly known, we're more than just that spa, spa professional or somebody goes to, kind of get away from it all and, the foofy, incense and lavender oil and things like that.
Foofy?
Well, I'm just saying. That's like, I'm just trying to take us away, basically put us in the context of, how we help people. So a lot of people look at massage therapists. Okay, I have a massage therapist that I go to, and so, they work on my neck, and then there's that person that you might go to once or maybe twice a month, or you might go to have a spa day. You go to like a hotel or a resort and get massage therapy work there. But for, I guess, in the context of fitness and wellness and trying to perform better, there is a need to kind of unload tension in the muscles. So like, one of the massage therapists I go to here locally, she knows where I hold my tension, which is going to be a lot of my traps and calves and hip flexors, right? So, and she knows my body. And if you have that kind of relationship, or that person that understands you, and they can de-stress you, and they can actually kind of perform what we would consider, more corrective exercise, where when it comes to inhibiting or even lengthening, depending on the massage therapist, they can actually help facilitate the range of motion, part of what you need to move better. Now, when I first went to massage therapy school, I worked for a chiropractor. So again, to kind of look at big picture, how these fields that we're talking about kind of can work together. In this chiropractor, he had a lot of referrals with auto accident injuries. So for me, it was a lot of working on the paraspinals and the hips and the shoulders, a lot of neck tension, definitely. But I complemented the work as far as tension relief for this chiropractor, either before the treatment or after the treatment, because one of the things that they realize is that the treatments actually hold longer when the muscles are relaxed, or the client's easier to work with when it comes to whatever adjustments that might be needed if they had gone through a treatment session for massage therapy beforehand. So a lot of times now, there's different specializations when it comes to what education massage therapists go through versus 30 years ago when I went through massage therapy school. So finding out what specializations your massage therapist might have, just like you would a physical therapist or a chiropractor, they can help you in different ways. And this is also helps you kind of curate, who you can go to for what situation when it comes to massage therapy.
And I think it's important to note, like you said, I mean, everyone kind of has, even though you've got certain letters, we still have a very specific clientele that we work for. We have a specific outcome that we do. So for example, with neuromuscular therapy, I have people do assessments and I look at everything. People come in like, oh my gosh, I've got something going on with my shoulder. And the first thing I do is I look at their foot and ankle and they're like, no, I said my shoulder. I'm like, I totally understand that, but I'm gonna look at everything at a whole, because sometimes it starts at your foot and ankle and leads to your shoulder. So, is it, the chicken or the egg? I look for it all. And so, and I charge per session. It may take me 30 minutes, which never does, but it may take that, or it may take an hour. It just kind of depends on what I'm looking for and what I'm trying to do in order to get better length throughout every joint, moving up the kinetic chain, which is just up your body. But to your point, when you do need to de-stress and, going to see an LMT, which is your licensed massage therapist, there are times where you really need some of the, some of the incense and some of the relaxation and the hot stones and the lighter touches. I mean, it doesn't always have to hurt. And that's one thing that I tell people, like, like just like a personal trainer and just like when you do a session, sometimes you just need to unload and let your body relax. And whatever it is that's going to get you to that point, that's also important. So think, you've got some that are lighter touches and some people that do cranial only, some people that work, for prenatal. So just like when you're looking for your physical therapist, as you mentioned, or you're going to your MD and then they send you off to someone, we all kind of hold our own lane and just make sure that everyone's up to date and, and that you trust them. But also, I think it's important, no matter what you guys do, when you go to see anybody in the field to help you move, feel, and perform at the highest level, interview them a little bit, find out more about them, look them up online, look at any of the comments and stuff, because I think that's extremely important. And sometimes we don't do that. We're like, oh, this looks like a good name. Oh, this one's close to my house. That may not be your best approach.
Right. Yeah, I mean, you want the best person for the job that you need to have done. And definitely there's, that's where I know like 3 massage therapists that I might go to for different things. Right. So
I love that you have time for massages. I am
I'm just saying, I know 3 people. But again, but it's also a resource for me to send people out, right? So I know somebody who has more of a sports related background. Okay, go to this person. Or if that person that might, just overall, you haven't had body work done in a while, good time to get the incense, get the hot stones and all that stuff. And I know this other person that does that. And I know somebody who has more of a rehabilitative background because they work as a physical therapist assistant and a massage therapist, so they understand the therapeutic side of things as well. So just knowing who's right for you and for what your situation is, but also as a good resource to refer out, because that's how we make a living, right? It's about word of mouth business.
Refer out.
Yeah, refer out. Yeah.
So Ken, why don't you, before we go and like move on into another one, so far we've talked about an MD, that's our the one that we know that's going to make us feel better and then kind of lead us into the right path. We talked about a chiropractor, we talked about a massage therapist, we've talked about an LMT, but I think with your background too, especially working in collegiate sports, how would you explain an athletic trainer in comparison to what we've talked about so far?
Well, again, this falls under the field of sports, right? So when we're talking about understanding when it comes to understanding the credentials and what people are, able to cater to, what we look at with athletic trainers, they are kind of the, I guess, your utility player, right? Because they are the first responders of sporting events, right? Someone goes down, who is it that runs to the field first, right? When it comes to, getting the ice and taping before and after an event, right? That's the person you go to. But what a lot of people don't see is that they're also working with the players and the athletes. Again, just kind of putting in the context of in my experience, collegiate sports. They're also working with the physical therapists and the doctors when it comes to the rehabilitation or the acute care of athletes, because hey, they have a softball player that has a shoulder issue, they have a gymnast with a low back issue, they have a football player with an ankle sprain. They got to be able to work with all of those environments, all of those sports, and have to be able to kind of make sure that there is a continuity of care when it comes to this environment of sport. But there's also athletic trainers that work in a rehabilitative environment. They work in physical therapy clinics. They can help with the rehabilitative process, as well as return to play programming. So again, when it comes to health, fitness, and wellness credentials, the athletic trainer winds up being that person that, they can make sure that if there's a risk of a neck injury or a concussion, they're skilled at acute injuries like that, but also on the back end in the rehabilitative process, they're also responsible for getting somebody, making sure that they make their treatment sessions and they're doing their rehab. But also as a strength conditioning coach, I worked with the athletic trainers pretty closely in making sure that as a strength coach, my job is for performance, but performance doesn't matter if the person's hurt. So if I can make accommodations for what that athlete is able to do, again, communicating with the athletic trainer, I'm better able to serve my athletes like that. But they have place in the sporting arena as well as the rehabilitative environment as well for what skill sets they have. But they definitely do a ton of hours to get that, and their test is not easy.
Yes, I mean, and I know for myself, I used to travel a lot with Major League Baseball, and I know we worked very closely with the athletic trainers. And guys, what you don't see on the back end, I mean, as Ken mentioned, there is so much that goes on behind the scenes, because they do the prep work. They usually have the athletes, especially that have some reoccurring issues or that may be tighter in certain areas and need some hands-on work. They work with everyone before they get out there on the field or court or whatever it may be. And so they do have to come in really early. They do work with all the players. Like during the games, they have to write things up. They have to send anything that happens, any incidences, they have to write out a report, send that to an MD, send that to the physical therapist. They always have, all the amount of writing, or if they're coming back from surgery or, coming out from rehab for some reason, they have to have all of these protocols and all of these notes. And so it's definitely not an easy task. And, a lot of times those guys are overlooked. However, being an athletic trainer, I know there's a lot of hours that goes into that. And, they're also the ones that, when you're starting out in, for example, minor league baseball, and you're in, A ball or even lower than that, you're sometimes doing laundry and looking at, separating the equipment. I mean, there's so many things that go into it, like rookie ball. I just remember the athletic trainer saying, "Oh my goodness, if I have to touch another dirty pair of pants, I think I may die." So, some of these jobs are not easy. However, it's one of those things that it is it's very, I think sometimes we don't talk about it enough, but those guys deserve a lot of credit for keeping these guys healthy on the field too.
Yeah. So as you're listening to both Wendy Batts and myself, Ken Miller here, we're talking about understanding credentials when it comes to health, fitness, and wellness. So on that point, Wendy, if you know an athletic trainer, if there's an athletic trainer in your life, one of the things I know they appreciate is a good gift card for Starbucks or some kind of local coffee shop, or someplace healthy and fast that they can get food, because they're there. They work from dark to dark, right? When they're setting up the training room, they also have to make sure that the last person out of there has, if they need ice, they have ice, or if they need treatment, they get treatment. But but also a gift certificate to your local fast food establishment. So if they need to run out for lunch, sometimes a good carne asada burrito.
Or just bring them something.
Or just bring them something, even better.
Yeah. And I think too, like when we look at everything, and again, I think one of the other ones that we want to talk about before we even end this is kind of talking a little bit about the differences of coaches. because I think this is also a term that another one of my clients asked me about, because I mean, most people understand like a coach of a basketball, a basketball team or a baseball team. You've got one coach that's there to, instruct and is involved in designing plays. And, that coach is over that entire team, making sure that they perform at their highest level, or if it's with an individual, having that individual perform at its highest level. That's something that most people understand. But, I think one thing, and Ken, you might be able to explain this very well, but now we've got wellness coaches, and we've got, strength coaches, and we have like all of these different coaches within our field that I think sometimes people really get confused about, like, well, what's the difference between a trainer, because we have personal trainers. And I know that's one thing, obviously, we're super passionate about, because we obviously are personal trainers as well. But, how do you, what's the differences between a trainer versus a coach, or is there a difference?
Well, then that's a really good question, Wendy, because I just talked to a personal trainer about this last week, because we were talking about, wellness coaching, right? As it's now a specialization within the National Academy of Sports Medicine. So when it comes to personal trainer, a lot, if we were going to draw a line between the two career paths or the job description, personal trainer, it's typically exercise or performance related, where the environment is in the health club, weight room, garage gym, personal training studio, where we're instructing somebody on movement and quality of movement. But when we're talking about, wellness coach, now we have to look at the whole person, right? We like to think that we talked about, or we consider the whole person to begin with when it comes to personal training. But now we have to dive deeper into, okay, what are your sleep patterns? How are you protecting sleep? How are you managing stress? What are the stressful, what are the stress points in your life? And how can we come up with behaviors that help you, address these things, or give you some coping skills when it comes to managing stress, or whatever it may be. We're looking at, overall, nutrition. Although again, we're not dietitians and laying out food plans, but we do want to know, it's like, okay, is the last meal out of your day going to be, a double cheeseburger with a strawberry shake? Or are there other things that we can look at to help you maximize your recovery from your workout or prepare you for the next day? So when we talk about wellness coach, we want to look at, okay, what is it going to take for you to maintain a healthy lifestyle through the building of better habits to maintain, for lack of a better word, wellness?
Yeah, I think that's important too, because, when you think about a wellness coach, it is just that, they want to coach you to the best life that you can. And they're going to look at all of your habits, good, bad, and different, offer suggestions, hold you accountable. What are you eating each day? Are you keeping a log? I mean, you're not necessarily giving them a food plan, because that, needs to have a registered dietitian. Usually that's giving specifics, especially if there's some sort of consideration that you need to take into consideration. And so, I think when we talk about wellness coaching, we're coaching someone on lifestyle changes and changing for the better, and looking at yourself, like you said, as a whole. And then when you're looking then at a physical therapist, a personal trainer, when you're looking at a personal trainer, what do? We look at how the body moves. And then we try to make it move to become this fine-tuned machine. So therefore, we're reducing the chance of injuries. We're really trying to get better range of motion, which is going to make you move better. You're going to work on activities of daily living, so it's going to make you safer. You're going to reduce injuries, and you're going to perform at whatever level you're going to take your programming to. So I think, a lot of times, and I know, like you said, with NASM, we now offer wellness coaching as well as personal training, and then everything, in between with different types of specializations, because it really kind of all is inclusive. And so if you see someone that has a PT, or a CPT, a certified personal trainer, because there are some, personal trainers that may not have may not be from an accredited body. So you want to make sure that it's a certified personal trainer from, someone that's accredited. I guess that's just, I'm just going to leave it at that. But anyway, you want to make sure they've gone through a process in order to get their certificate. And then again, you're going to see other types of specializations. And like Ken and I have the corrective exercise specialization, where we focus on particular ranges of motion and movement patterns. We have our PES, which is a performance enhancement specialist, which is where we're going to take it to a higher level with more of our performance athletes on, different things to consider and different types of assessments to get someone moving in all three planes of motion fast, quickly, explosively, but also safely and effectively. So therefore they're more efficient. And so, I think just be careful when you're looking at, the differences between coaches, because again, we're trying to better in performance, but there's a difference between wellness coaches and a team coach, and differences between a personal trainer and somebody that's specialized in exercise. Does that make sense? Did I confuse myself?
No, it makes sense to me, but I think this might be something we need to talk about on another episode, is when we talk about specializations, right? We talk about different areas of emphasis and what makes you different from the guy down the street, right? So when you're bringing up corrective exercise, performance enhancement, and things related to personal training, and that's, again, one of the reasons why we're doing this episode, is because professionals come in with all sorts of letters behind their name, and it is up to you to make sure that, for one, they are who they say they are. Again, doing your due diligence, as you mentioned, Wendy, and making sure that they are who they say they are, but also, is it the right background for you? So again, going back to the beginning, whether it's a medical doctor, chiropractor, physical therapist, massage therapist, athletic trainer, personal trainer, or a wellness coach, you understand that is the right person for you, and it's a person, because you're going to spend probably, it's not going to be one of those jobs where you're getting $20 an hour for compensation. You're going to be spending quite a bit of money, right? Mm-hmm. It's going to be an investment in time, energy, and effort, and definitely your finances, especially if it's going to be something where it's going to be an ongoing need. It's going to take some investment, and you want to make sure that you're getting the right instruction, the right level of help when it comes to understanding these credentials that are out there. So having letters is great, but make sure that they're the right letters that you need.
And that's one thing too. If you have insurance, it's important to check with your insurance companies, because sometimes things are covered by insurance and sometimes it's not. But I think, at the end of the day, when people are talking about, investing in a personal training or trainer, or investing in a wellness coach and investing in all this stuff, and they say to me, man, I just spent this amount of money this month on this, that, or the other, working with an individual to help them better their life and make lifestyle changes that are very positive. The only thing, my usual response is, well, how much is your health worth? Because, that's something too, that when you're budgeting out at the beginning of the year and you're looking at everything, if you don't feel well, then what are you going to do to make yourself feel better? Maybe go to the doctor, do your annual checkups. Those are usually covered by insurance, where you don't have to pay anything. If you, do need to go and see a physical therapist because, something's specifically in pain and your doctor recommended a PT, then go to your physical therapist for however many sessions, then maybe continue on to someone that is a personal trainer that can help you, because, you should be able to walk down the street without feeling out of breath. You should be able to climb stairs without, hurting your knee and stuff. And so I think my key takeaway is think about yourself, look at the different credentials, and then find the best person to help you live your best life.
That's right. And it's all about living your best life. There is somebody there to help you out do that. Yeah. So thanks, Wendy. I appreciate your time today. It's always good hanging out with you, and especially diving into these topics that, that don't get discussed, but should. So thanks again for your time, Wendy. And for all of you that are listening to us here today or watching us on YouTube, thank you for watching Random Fit. If there's something that you'd like to have us talk about, especially like with this episode with credentials, again, a lot of information out there, but make sure you come to us with the intent of learning more about what personal training, wellness coaching, and all that stuff can do for you. But like, follow, subscribe, and comment. Let us know what you want to hear about. And until next time, take care and be well.